Lung cancer is a disease in which certain cells in the lungs become abnormal and multiply uncontrollably to form a tumor. Lung cancer may or may not cause signs and symptoms in its early stages. Some people with lung cancer have chest pain, frequent coughing, breathing problems, trouble swallowing or speaking, blood in the mucus, loss of appetite, and weight loss. Lung cancer occurs most often in adults that are in their 60s to 70s. Most people who develop lung cancer have a long-term history of smoking. However, this condition can occur in people who have never smoked. Most lung cancers are the result of somatic mutations that occur within the cells of the lungs. However, there are some cases that are related to an inherited pattern. When the disease is inherited, it is an autosomal dominant pattern, meaning that one copy of the gene is enough to have an increased risk of developing lung cancer. It is important to understand that because a person has the inherited gene does not mean that they will develop lung cancer. It means that they are at a higher risk for developing lung cancer. Mutations in the EGFR gene result in small cell lung cancers, and mutations in the KRAS gene result in non-small cell lung cancers. Non-small cell lung cancers consist of three types: adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancers grow much faster than non-small cell lung cancers do and are very rare in non-smokers. These genes each provide instructions for making protein that is embedded within the cell membrane. When these proteins are activated by binding to other molecules, signaling pathways are triggered within the cell that promotes cell growth and division. These two mutations account for half of all lung cancers in America. The patient and their families may have trouble being able to afford the cost of treatment. The average cost of treatment for lung cancer is about $11,000 a month. Families may also experience a lot of emotional tension that comes with the end phases of lung cancer. Also, genetic counseling is not really a good choice for these patients because it is very expensive and the likelihood of their child getting cancer is only higher, but it does not mean that they will definitely have lung cancer. The nurse's role with lung cancer is to provide the best holistic care possible and be an advocate for the patient. Many times with lung cancer, the treatment options are not successful and it can be very hard for the family to see what the patient wants to do. Immunotherapy is being used for patients that general lung cancer treatment such as chemotherapy, radiation, or surgery has not worked for. While the survival rate of lung cancer still remains very low, new target therapies and immunotherapies have been proven to show that they may have some positive effects for the patient. Immunotherapy activates a part of the patient's immune system to fight cancer and work to destroy the cancer cells. Immunotherapy can stop or slow growth of the cancer cells and keep it from spreading in the body.